Um, Good morning, everyone, and welcome to Beyond the Behaviour, a practical introduction to positive behaviour support. Thank you so much for joining us today. Before we begin, I'd like to acknowledge the traditional owners of the lands on which we each meet today. I pay my respects to elders past and present and extend that respect to all Aboriginal and Torres Strait Islander people joining us today. I'm Emma Weinlich, Managing Director of Voyage Support, and I'd like to sincerely thank you all for joining us today. Many of you know Voyage Support through our specialist support coordination services. Over the past few months, we've been excited to expand our positive behaviour support team, and today's webinar is the first in what we hope will become a series of practical conversations that build understanding, encourage collaboration, and ultimately improve outcomes for the people we all support. I'm delighted to introduce today's presenters. Angela Daye is our Head of Positive Behaviour Support. Angela has more than 15 years of experience across disability, child protection, youth justice, and complex care. She's passionate about person-centred, trauma-informed practice and is committed to supporting practitioners to deliver high-quality positive behaviour support. Joining Angela is Natalie Turner, one of our behaviour support practitioners. Natalie has a background in psychology and works closely with participants, families and support teams to develop practical, evidence-informed strategies that improve quality of life. We also have Kayla, another of our behaviour support practitioners, joining us today. She'll be monitoring the chat throughout the presentation and facilitating our Q&A session at the end. I feel incredibly fortunate to work alongside such a knowledgeable and passionate team, and I'm really looking forward to today's discussion. We've got a couple of housekeeping items. This session is being recorded, so if you'd like to revisit it or share with your colleagues, the recording will be available after the webinar on our YouTube channel. If you have any questions during the presentation, please pop them into the Q&A as they come to mind. Kayla will be monitoring these and will answer as many as we can at the end. Everything we'll discuss today is intended as general information based on professional practice and experience. As every person's circumstances are unique, today's discussion shouldn't be taken as individual clinical or professional advice. Today's session will be guided by many of the questions you submitted when you registered for the webinar. Rather than focusing on theory alone, Angela and Natalie will bring positive behaviour support to life through practical insights, real-world examples and experiences from practice. Whether you're a participant, family member, support coordinator, BSP, allied health professional or support worker, we hope you'll leave today with a greater understanding of positive behaviour support, a better appreciation of the role of the practitioner and practical ideas that you can take back to your own practice. I'll now hand over to Angela and Natalie, and I hope you enjoy the next session. I hope you enjoy the session.
Thanks, Emma. Welcome, everybody. A little bit of a different take on a webinar today. I'm just going to speak from the heart about what I believe positive behaviour support to be and use some practical examples of my experiences matched with some experiences that Natalie, one of our positive behaviour support practitioners, has with her participants as well, so that hopefully together we can bring you a bit more of an idea of what our day-to-day role looks like, what positive behaviour support is, and how it fits into the NDIS. As you can see on the screen right now, this is how the NDIS defines positive behaviour support. We hear these words a lot. We hear person-centred, evidence-informed, quality of life, understanding the reasons behind behaviours, and developing positive and proactive strategies that meet a person's needs. So it's understanding that all behaviour has meaning and serves a purpose. But what does that really mean? And that's what I want to talk about in this first section. When we talk about behaviour, we talk about it almost like it's a buzzword. Behaviour, it's something different. It's almost like a dirty word that's used in the industry to explain something that maybe is naughty or bad or poor or unacceptable. But really, in everyday life, we all behave in different ways. And a lot of that has to do with who we are as people, what our experiences are, our environments, our upbringing, our culture. There are so many different aspects of our day-to-day lives that define behavior and what that means to us, and also what that means to those around us. When I think about behavior, I don't think about the obvious things that people would define behavior as, which may be things that are more newsworthy. You know, somebody has done something that is a criminal, so it's therefore a bad behavior, and we talk about it in that context. When we talk about the role that we do in positive behavior support, we look at it as, what does that behavior look like to that person? Now, a behavior might be something that is, you know, dangerous. It might be something that has high risk. It could be something where it puts a person or those people around that person in danger. Such things might be physical aggression, absconding, the use of weapons, be it actual weapons or whether it's using furniture through weapons or glass bottles, etc. It might be property damage to an extreme. It could also be something like verbal aggression, which may not seem such a behavior when you compare it with other situations that put people at greater risk in terms of physical risk. But it can have such a profound effect on a person that it can affect them in so many different areas that maybe aren't discussed as commonly. When we look at behavior, we look at that person as an individual and what they're trying to communicate. So behavior to us might be as simple as just not making eye-to-eye contact with somebody, withdrawing. It might be something such as becoming more reclusive or less involved in day-to-day activities than you used to be. It might be something like suddenly, you know, the things that that person used to enjoy doing, they suddenly disengage from, and we don't understand why. Something that somebody really used to find really fun and enjoyable is suddenly not something that they want to engage in anymore. What's happened there? Before you've all come into this session today, each and every one of you has experienced your morning differently to the other. Even if you're sitting in the same workplace as your colleague, your route to work might have been different. If any of you are in Victoria right now, as I am, with primary school aged children, you might have a teacher strike today. So you might be negotiating having children at home when that's unexpected on a Thursday when children have just gone back to term. All of these things happen and shape our day and the way that we will behave throughout our day. Sometimes these things are planned and sometimes these things are completely out of our control. So why do we look at that differently? And why should we look at that differently through the lens of disability? The simple answer is we shouldn't. The difference is between disability and you or I is absolutely minimal. The only real explanation can be what people maybe don't have the tools to explain exactly what they feel in that moment, or they don't understand why they're feeling that way and they can't articulate that properly. That may be due to their disability. It may also be due to the respondents that are receiving that information. Perhaps they're not understanding what a person is trying to say. So when we talk about person-centered, it really is about that person, what they've experienced, and also the receiving audience, what they're understanding. We're not seeing that person properly if we're not understanding what makes them who they are. That's the biggest part of our role. If we don't understand a person and everything that makes that person who they are, who's involved in their lives, what they like and what they don't like, if we don't listen to them and understand them, we're never going to get our plans correct. Because at the end of the day, we're all just human and we're all just getting on with life the best way that we can. We need to see that person and not what's on that referral, not that disability description, not that behavior description. We need to walk into that environment with open eyes and we need to observe what's really going on in that person's life. And we need to ask questions and be inquisitive and involve ourselves in that world, not just where behaviors are occurring, but also where behaviors aren't occurring. What makes them happy? What makes their lives fulfilled? We also really need to look at certain things that, if you've read a behaviour support plan before, or if you've written a behaviour support plan before, you'll have seen setting events. Setting events occur when that are things that are out of our control. You might wake up with a headache. If you wake up with a headache, I can guarantee most of us have had headaches before. We will wake up and maybe our mood's not the same. We might not feel like we're as tolerant of noise or as eager to engage in activities, or we might not want to look at our screens because of the light, because we've got a headache. Maybe we've had a poor night's sleep. We've had lots of distractions. We can't concentrate properly on the things that we would usually take pleasure in because we're tired. What we need to do is listen to what's happened and what's happening in that person's environment and observe that and read between the lines and see that person, not just the behavior. We need to work with people and we need to see what's important to those people. We need to work towards understanding their likes and their dislikes and what gives them pleasure. We also need to look at their history, what may be traumatic for them, what their experiences may have been. Trauma itself is a whole new topic, which we will discuss in further seminars and webinars. However, what might be trauma to me might not be trauma to you, and the severity of which should never be judged. We need to build on people's strengths and abilities whilst always promoting choice, dignity, and independence. We are working with people who all have their individual wants and needs. At the end of the day, our role is to improve a person's quality of life to the best possible quality of life that can look like for them. What we don't want to be doing is defining somebody by their behaviour or by their diagnosis. That doesn't make a person. I am English, as many of you might be able to tell through my accent. Being English doesn't make me different to being Australian. It doesn't make me a different person. However, my experiences may be different. My culture may be different. The traditions that I have may be different to Australian traditions. I may say words slightly differently. I still say yogurt and my children go, "Oh, Mom, it's yogurt." I can't change that. It's just who I am. It's what I know that people here say the word yogurt and not yogurt, but that's just who I am. That's how I was brought up, and that's just what my beliefs are. That's how I like to communicate. What we don't do is take a one-size-fits-all approach, my way or the highway. We don't focus on problems and deficits of a person. We want to build strength. That's what person-centered positive behavior support is all about. If you were to open a plan and just read all the negative things about a person, it would be a very, very horrible read. And also, it wouldn't be received very well by people. We want to not prioritize compliance over meaningful outcomes. If we, as behaviour support practitioners, are writing plans for the Commission, we shouldn't be in this job. Of course, we have certain legislations and rules and regulations that we have to abide by. But we are writing a plan that should be eliciting positive change to the people that we're supporting and those in their environment. We shouldn't be writing a plan to check boxes and tick boxes and go, next. We simply shouldn't be trying to stop behaviours of concern. You'll have heard many times before, behaviour is purposeful to that person, and it is. So we should be looking at what that purpose is behind that behaviour, what they're trying to communicate. I'm going to hand over to Natalie now, who's going to use some real life experiences when talking about person-centered practice in her everyday delivery. Over to you, Nat.
Thanks, Ange. I just want to expand on that person-centered practice. I think that word's got a whole, it's an umbrella word that covers so much. And if you try and use that and hold on to that, sometimes people get confused. So I want to speak to everybody today about what person-centered actually looks like for me in everyday practice. The question for me has always been, how do I make sure that I'm being person-centered in my role consistently? How do I keep myself accountable? And how do I help the people around me support participants in a way that is also truly centered on the person rather than their behaviours or even just about their role within their job? For me, it comes down to one simple word that is achievable to all, and that's curiosity. So there's two quotes that actually fall under that title, curiosity, that has stayed with me throughout my career. And the first one is, always look further. So your eyes can see objects, but a magnifying glass can turn observations into understanding. And my favorite is that curiosity turns challenging behavior into meaningful information. So when we're looking at person-centered, these quotes aren't just nice sayings. They are the lens that I practice with. So whenever I catch myself or hear someone else describing a behavior as attention-seeking or manipulative or non-compliant, aggressive, sort of putting that label onto that behavior, the one simple question that I ask is, what are we missing? And that's the moment that I become curious, and we stop trying to to explain the behavior and start to try and understand the person behind it. So curiosity shifts us away from assumptions and towards understanding. It encourages us to slow down, to ask better questions, to consider the whole person. It reminds us that behavior doesn't happen in isolation. For me, that's what person-centered practice is in its simplest form. It's also the foundation, as what Ange touched on, with trauma-informed practice. When we lead with curiosity instead of judgment, and what I mean by judgment, I mean assumptions, labels, the conclusions that we naturally draw to before we fully understand that person's experience. When we look through the eyes of curiosity, we naturally respond with more empathy, more patience, and more respect. We create relationships where people feel safe enough to communicate, and where families and support workers feel heard rather than criticised, and where participants are actually understood for who they are, not simply for what they do. And one of the reasons why I keep coming back to curiosity is because it's something everyone can practice. Whether you're a behaviour support practitioner, support worker, a parent, teacher, therapist, you don't need another framework to remember. Curiosity is also already part of being human. It's simply choosing to build a professional response from that. So when we make that small shift, person-centered practice stops from being a concept we talk about and actually becomes the way that we relate to people every single day. And in my experience, that's where the most meaningful changes begin. So curiosity is definitely a foundation that I practice from. And it's easier to remember than actually the total umbrella of being person-centered. Over to you, Ange.
Thank you, Nat. That's really insightful. I'm going to move on to the next one, which is the role of a positive behaviour support practitioner. What a loaded title. The role of a positive behaviour support practitioner, where do I start? What is our actual role? Well, if you were to throw it out or go for a job interview as a PBS, you would hear words such as, working towards, writing a positive behaviour support plan. If there are restrictive practices, we have to meet legislative requirements. We have to meet timeframes. We must do an interim. We must do an FPA. We must do a comprehensive. We must produce a document that is worthy of being called a behaviour support plan. But that's really not the role of a behaviour support practitioner. That's the admin of a behaviour support practitioner. Our role is really to go in there and really understand that person. If I've ever met you before and talked about behaviour support, you may have heard me speak about this before, so apologies if I'm repeating myself. But the way I like to talk about behaviour support and the way that I introduce behaviour support to newer practitioners is by looking at it like the world. If we look at the world, 70% of that world is water. 30% of that world is land. We should be the water in that world. We should be swimming around that world wherever we can. We should be going into the nooks and crevices. We should be riding in the high tide. We should be going into the deep depths of the water. We should be riding the waves. We should be circling around the kids having fun at the beach. We should be fostering growth and safeness for all the animals that swim in there, all of that stuff. The only time we should be on the land is when we're writing. The land is our desks. The land is when we're sitting in front of our computer and we're putting our information together. That information is only useful if we know that person and the people we're receiving that information from know that person. We work in time-limited intervention. Everybody in the NDIS does. That time-limited intervention puts dollar signs next to everything that we do. Our role is not to look at those dollar signs as timeframes of we should be doing this with this amount of money and this with that amount of money. We should be looking at how we can best improve this person's quality of life and work with the people that we are working with, whether they be support workers, whether they be family members, whether they be schools, teachers, child safety, people in corrections, anything to do with the DFFH. We're there to understand that person and everything that's in their lives. Our role is not to produce a doorstop that's going to be used to collect dust. A million pieces of paper about a person that nobody's going to read. Our role is to immerse ourselves in the world of that person, to spend time with that person, to go into areas of that person's life where they have fun and they're enjoying themselves and there are no behaviors, but also to go into that world where we are there as observers. So if we're going out with a support worker, for example, doing an activity that the participant has enjoyed, we're asking that support worker or that parent to collect data for us. It's our job. We need that data to be able to formulate strategies and meaningful teaching skills. But we might see things through our observations that the support worker can't. And we're going to go into depth a little bit about the role of the support worker and the role of a family, because it's really important, and also the roles of schools, etc. Everybody knows what a teacher's there to do. Everyone has different ideas on parenting, and people will have different ideas on support. And that is also shaped by their history, their lives, their days, how they've come to work that morning. Everybody has a role to play. So when we look at behaviour support and we're doing our observations, we need to look at what maybe that support worker or that family member can't see. Perhaps when we're in that environment, the support worker is there to keep somebody safe, to stop them from running onto a busy area, to make sure that they're not running off when they're in the shopping centre, maybe to make sure that they're sitting down and eating their lunch or having plenty of water to drink, or engaging them in meaningful day-to-day capacity building skills. But what maybe they're not seeing is the body skills, the body movements behind. Perhaps we start to see someone clasping their hands and rubbing their hands together, or starting to, show signs of agitation or pacing or breathing heavier. Things that maybe a support worker or a family member possibly doesn't see because they're too busy trying to do their actual role. So our job is there to support that. So we work with people behind the scenes as well to see what maybe they can't see when they're actually just doing their day-to-day job. We look at things like the setting events and the triggers that I discussed before. I've seen very many plans in my time, and I've seen triggers that would indicate that a person is triggered by almost everything in their environment. That's not the case. Our role, essentially, is to reduce the frequency, intensity, and duration of those behaviours so that we can keep a person at baseline for as long as possible. So A, they're happier, B, they're experiencing a better quality of life, and C, we're able to teach them more appropriate skills in order for them to communicate their wants, needs, fears, scares, whatever it might be, their pain, whatever it might be, whatever that function might be. We're there to look at what that is and to teach new skills on enabling a person to communicate that without engaging in those risk behaviours. We can only do that if we understand what those real setting events and those real triggers are. And what we need to do is really not only observe that from our own perspectives, but also work with the families, the teachers, the support workers to understand what they see much more closely than what we see. They're with the participants so much more than we are, and we need to work collectively and share ideas about what's going to work and what's not going to work if we want the best outcomes for the participant. One of the major roles that we work alongside as support workers. Support workers' roles are there to essentially keep a person engaged, safe, fed. They might provide medication if medication is required. They might do community outings, play games, engage with the participant in meaningful ways as well as routine ways. We need that support worker on our side, not only for the implementation of the plan when it's developed, but also gathering that information. I'm going to hand over to Natalie, who's going to give a bit of information on her work with support workers and how valuable it is in the day-to-day lives of working with our participants. Over to you, Nat.
Thanks, Ange. So Ange touched on the role of the BSP in actually working alongside the support workers to observe the setting events triggers and to extend knowledge to the support workers in how they see the participant and their behaviours as well. But there's more to that as well that I'd like to add. A significant part of a BSP role is adapting the way you engage to people that are supporting the participant. I engage with families and formal supports in completely separate ways. So if by trying to improve somebody's quality of life and build their capacity to reach their goals, it's not just about understanding the participant, as what Ange is explaining. It's also about understanding the people that are supporting them every day. So I can bring strategies and recommendations. I can train, monitor, collect the data, report, do everything that is required within my role. But if I don't connect with the team and understand their own individual capacity, confidence, work ethic, motivations, I'm missing a huge part of the picture. So even the best behaviour support plan won't make a difference if the people implementing it don't feel connected to it or understand their role or what benefits it will provide the participant and to them. So we speak about one of the things that our role is not to do is to adapt to a provider or a service. And that's not what I'm saying to do at all. What I am saying is that we need to be realistic and we need to make people feel important and that their roles matter. And that I'm not there to add to their already heavy workload. I'm there with the aim to make it lighter. That's why I approach my role with humility. I don't see myself as separate to the team. I don't, or someone that comes in with all the answers. I don't have all the answers. I work alongside the people who know the participant in ways that I never will. Support workers are there through the ordinary moments, the hard times. Their insight is invaluable. And to build the trust and professional relationships with them is needed, and it needs to be with everybody involved. So when support workers know that I genuinely value their observations, they share what really matters, what works, what didn't, and what was different that day. When they really feel confident, build trust with me, they start to say what they personally are struggling with and why, without that fear that they will possibly lose their jobs or have their hours cut if they admit that they have some weaknesses. And that's just a human response. So those conversations actually provide the clearest understanding of why behaviours happen. And they also allow me personally to refine strategies or train one-on-one with supports to the betterment of my participant. I've also found that an added bonus to this is that when supports actually take more of an active interest and role, and want to develop their curiosity and understanding, but that foundation rolls over into every other person they support. To me, that's what good behaviour support is about. It's about building relationships, sharing knowledge with humility, and creating meaningful change together as a team.
Perfect. Thank you, Natalie. So we've touched there on the role of the support worker, and briefly before I mentioned, we also talk about parental responsibility and families. You all have heard a lot of times in the past, particularly when working with children, that, oh, we can't provide support workers for that because that's parental responsibility. That's the parent's job. The parent's role is there to support their child. I mean, I'm sure there's parents amongst the screens here, myself included. Our role is to keep them safe, to keep them fed, to keep them happy. We want the best for them. Our role doesn't begin with a start and an end shift. We can't clock out. We don't go to work. We wake up to it. We might wake up several times throughout the night to it. We're there for the bad, the good, the ugly, just like support workers are as well. But our job isn't paid. It's there to nurture and to intrinsically want the best possible outcome for the person or the people that we love. We're navigating a lifelong relationship and balancing advocacy, appointments, education, family commitments, other children within the family, our own strengths and weaknesses. So we need to look at where PBS fits within the family dynamics as well, and how we can incorporate the family dynamics into the role that we play as PBS practitioners. We need to not ask questions that sound intrusive, but build empathy and work with the parents, listen to what they have to say to improve that person's quality of life. We're going to look now at an example that Natalie's going to bring around working with families and how important that is. And of course, as many of you know, it's, a parent's job never stops. It doesn't matter if your child is 5, 15 or 50. The parent's role never ends. But it does expand, it does change, it does reduce, it's malleable, it does differ depending on certain situations. So that's going to give us a bit of an example of working with families with children under the age of 18 still living at home. So over to you, Natalie. I feel like I'm a radio presenter. Over to you.
Look, when I talk about adapting, my experiences with families, by the time the behaviour support is involved and accepted as a necessary part of a participant's funding, that many parents and caregivers are already exhausted. So burnout, trauma, chronic stress influence and can change how people think, communicate, solve problems and cope. So working with families is totally different to working with formal supports. Families, like Angela was saying, do not get a break. They do not get to go home after their shift. They have no separation. And every parent wants the best for their child. And that can create feelings of guilt, failure, and lower their self-worth. So as a BSP, you cannot speak, act, treat, or implement strategies with the participant's family the same way you present it to a formal team. Behaviour support extends within this situation. Supporting the participant now involves recognising and supporting the caregivers as well. I often think of behaviour support is like putting a puzzle together, and that every participant, every family, every situation is different. So the pieces are never the same. Sometimes the strategies aren't the starting point when you come to families. Sometimes they are the destination. So one of my participants I'm supporting right now has significant risk of harm behaviours directed almost solely towards their single mother. We know what strategies will help, but implementation isn't the challenge. Capacity is. So both parent and child are living in constant state of stress and emotional exhaustion. which leaves little room for learning or change. Their nervous system thinks that their parasympathetic response is basically normal, and that calm within their sympathetic nervous system is not. So they both have developed significant conditioned responses and maladaptive coping strategies, which keeps them in this circle of heightened distress. And for behaviour strategies to have any impact or positive effect, baseline or calm is needed. So the first step for this participant is not to implement the strategies. It's not to come in with a magic wand and say, this will fix all, because that won't work, and it can create further feelings of failure and guilt for the parent. It can actually do more damage than good. So the first step is to provide support and guidance for both the child and mum to change what their bodies think is normal and work towards the baseline. So right now, success isn't measured by a perfect strategy implementation. A baseline is where both parent and child feel heard, supported, and ready to accept help. Once that foundation exists, behaviour strategies have somewhere to land. That's when it becomes a part of lasting change instead of another expectation added to an already overwhelmed situation and a band-aid that will eventually fail. And that's where the balance and the experience and the professionalism of a good BSP understands and is comfortable to accept and to develop, change, refine how they support their participant, what their goals are, and what is realistic for that situation. And this is what actually excites me about my role, because no two participants are the same. And I adapt and change, and it's just like a total moving system constantly. And if you have a BSP where that support and those strategies and that whole system is not flowing, then you really need to question why. And I'll leave it with that, because that is a totally new webinar that we're going to discuss further. Back to you,
Thanks, Thank you. I want to leave some room at the end of this for some questions, but I am going to just run by some of the things that we have touched on. I think one of the biggest takeaways from all of this is that we don't have all of the answers. We are behaviour support practitioners. Our role is important and we have a role to play. But we can't do that on our own. We need a team. I also want to highlight that it's not a race. Everybody is different. Everybody experiences things differently. To put it bluntly and very, I suppose, understandable to many people on the screen, let's think of it as, you know, if we're all trying to achieve the same outcome, we're all going to have different results. An outcome can't be fixing a behavior, because the behavior isn't something that needs to be fixed. It's not something that is broken. There are different ways to getting to the same place, and those different ways need to be explored, because every single person that we're working with has different strengths and different weaknesses that may lend themselves to those different routes. If we think about behaviour support like a roadmap, which it's often referred to, that's a lovely way of thinking about it. There's a person, there's a destination, and there's that journey to get to that destination. But that destination can be ever changing. And that roadmap that we've nicely designed may suddenly have roadworks on it. Or there might be a landslide. Or there might be a herd of cows crossing the road, which slows us all down. Our tire may blow and we have to stop and change it. Meanwhile, the person going down the other route, they might get there a little bit quicker, but they may face their own hurdles on the way to get to that destination too. So when we're thinking about behaviour support plans, it should never be finite. It's not an encyclopedia about a person. It's simply a working document that is subject to change, And we're never going to completely eradicate behaviors. That's not our job. That's like telling me that I can no longer shout. That's like telling me that I can no longer get upset or angry at something that doesn't go my way. That's not going to happen. I can learn to manage that in a different way. I can learn to manage that more calmly and to maybe explain why I'm feeling upset and to maybe explain why I'm feeling angry instead of maybe engaging in shouting or throwing something or slamming a door to get the attention of people that I want to get the attention of, or to escape an area I don't want to be in or a non-preferred activity. I may cry because I'm not getting my own way. I may cry because I'm in pain, but I'm doing it for a reason. And I want you to listen to that reason. And sometimes that reason might be different. There's not one shoe that fits all, there's not one size that fits all. And during that time, situations will change. You know, I'm a girl. I've grown up. My clothes size have changed, my shoe size have changed. I've had babies. Things have changed. Even when I'm at my adult, things change. And this is what happens in people's lives. People come into it, people leave it. Support workers come in, support workers leave. Family members that may have been there with you for breakfast, lunch, and dinner suddenly have jobs. They have their own children. They have their own homes that they live in. They don't live in the family home anymore. You might be living in a supported accommodation. Suddenly a housemate moves out and a new housemate moves in. There are always going to be changes that are going to affect somebody's environment. And our role is there to encompass all of that and to understand that and to work together with everybody in that person's community to provide the best possible outcomes for that person. A behaviour support plan is not the one with the most strategies. It's not the one with the fanciest words that people need a thesaurus to try and understand, not a thesaurus, a dictionary rather, to try and understand. It's the one that becomes most effective when it fits into that person's world. So I just want to leave it at that and open up for any questions. If anybody has any questions, I can see Kayla's put one up there at the moment, but I'll just give everybody a minute. If they want to ask any questions, please feel free to do so. Or if you want any elaboration, further elaboration on anything that Natalie and I have spoken about, please do so. This is your opportunity to ask anything, and there is no stupid questions, and we will do our best to try and answer those in whatever way we can. So please feel free to pop anything or pop your hand up if you have a question and you don't have the ability to write it if you're looking through your phone. That's absolutely fine.
And Ange, while we're waiting for those questions to come through, I just wanted to touch more about that function of behaviour, which we can discuss, in future webinars. But when I talk about today about curiosity, about adapting, within my role to different environments, etc. We also got to, it's written down that the basis of behavior comes down to those ABCs, what is actually happens before, during, and after a behavior. But there is a lot more involved in understanding that behavior. History of that participant is so very important. And not only the history of that participant, but also within that family that you've got to take into consideration. Because if you don't understand what is maintaining that function, then even if you have a full comprehension of actually what is happening in that moment, those maintaining factors that are contributing to those setting events and triggers actually override any strategies that are implemented because you don't have that full picture. So I just wanted to place the seed for people listening today that this is to be considered as well. And that what is written and what is defined on paper as to our role and how we fit in within the NDIS framework is not necessarily a complete picture. And I think that a lot of BSPs think it is. And our aim within Voyage Support is to expand that and to really create, practitioners that have got that curiosity and that spark and that will to want to support and change. And I think that that is essential with everything that we do within this industry. So that's my little finish.
Absolutely. Thanks, Natalie. Kayla, do we have any questions?
We haven't had anyone put anything in the Q&A, which is obviously very fine. Sometimes, you know, questions don't come to us until the very end when we've had time to sit on things. But I did pop a couple of questions in there. So I'll open
the ones
the floor.
that came up before. Yeah, beautiful.
Yeah. I'll put them out there. So the first one we have is, how do you achieve trust and getting to know a person if they can't verbally communicate with you?
That's a good question. Yeah.
Yeah.
Did you want to add to that, or?
I'm happy to start with a little bit of an answer for this. So when someone can't verbally communicate, it's really important to sit and observe and watch other tells. Because someone's not using words does not mean that they are not communicating with you. It could be a facial expression that means that they're in pain, which is really common for parents to pick up on. And that is another really good reason as to why working with families is really important. It could be a handhold and a pull in the direction and a point of something they want. And that is also really important as to, you know, sitting with the person and waiting for them to show you something rather than just going, oh, they can't verbally communicate. I'm going to ignore that participant and I'm going to talk to the care team and the families and not actually spend time with them. Their little tells that they've developed over their lifetime to communicate is something that's really important for us to try and understand. And if you know that person is deaf and they can use Auslan, let's get an interpreter in. Or, you know, is there a way that we can learn little things like a simple hello for them and how are you today? 2 little signs that we can learn ourselves, because then that shows that person that we respect that that's how they communicate. Anything to add, Ange or Nat?
Yeah, I think that's really, really important. We need to become a safe and predictable person in that environment for them. We're not going to be a constant like support workers and family members are going to be, but we need to be trusted. We need to show that we're engaging and sit down and talk to that participant. And if we can communicate with that participant about things that are important to them and that make up their world, and show that understanding and that empathy there as well. And we can do that in ways without using words. We can show through being present. We can show through our eye contact. We can show through our engagement and showing interest in the activities that they're trying to show us. We can demonstrate that through our understanding if they're trying to communicate something to us or take us to somewhere. But then we can develop tools around that as well. So once we understand a person's communication, we can develop meaningful, it could be social stories, or it could be slides, it could be pictures, it could be things that they can point to, it could be something that they can press and makes a sound. We can assist and work with the other members of the allied health team to develop things that are going to be useful in that everyday environment. I've worked with somebody in the past that has been profoundly deaf and has not had the art of communication with somebody that knew Auslan for 5 years during her support. So for 5 years, she was relying on people trying to guess what she was trying to communicate. I don't know about anybody else in this room, but if somebody was trying to do that to me for 5 years, I'd become very frustrated and I'd be very angry, and I may be behaving in ways through that. Because I can't communicate effectively the simplest of things. In saying that, I've also worked with people with acquired brain injuries, or people who have had strokes or dementia, or people who can no longer speak anymore and communicate their needs in the way that they used to. that doesn't mean that that person's not there anymore. If you're seeing somebody that's in an aged care facility or somebody in a supported disability accommodation that's trying to do something and that person is pushing it away, they don't want it, but that support worker's there going, you must have this. This is your lunch. You need food. It's not that the support worker is trying to be mean. Their support workers there trying to do their job. That's what's been provided and that's what they need to be eating. But if that person's pushing it away, they're trying to tell you something. So listen to it. They may be trying to say, I don't want jelly. I don't like jelly. Take jelly away. I've never liked jelly. But nobody has spent the time to listen, to understand, to watch, to observe, to speak about the history. What do they like? What don't they like? So even if a person can't verbalize what they mean, doesn't mean that they can't tell us. So we need to be patient and we need to listen. If that answers that question. Or anything else?
Another question we have, and I'll throw to you guys, is how do we collaborate holistically and with the whole care team if parts of the plan are low? So if we've got lots of funding and ready to go, but maybe OT is looking a little bit drained, or support coordination's a little bit low, or support workers are a little bit low, how can we collaborate holistically?
That's a really good, common question. Yeah, it's a good question. Nat, do you want to go first?
Yeah, I think so. It comes with experience as well as to what fits within a PBS role, where our boundaries are, and how far we can push outside that role. With all my experience, you've got behaviour support, you've got OTs, you've got speech, and it really depends on how the funding works, how much information that the NDIS has received as to where the funding has been allocated. But having differences in hours in that doesn't mean that support needs to wane. What it means is that you go to the widest scope of your behaviour support so it balances with the OT and the speech. You work together so that your strategies align, that it sort of overlaps, but you're not going outside your scope. You're actually just working together and minimising those hours and that duplication and those double ups. So that can all happen effectively if you've got a team that understands and works towards the same goal. And if you can work towards the same goal and have that mutual respect for each other, that confidence in each other, and each individual professional has that, professional relationship with that participant, family, support team, or whatnot, then everything is malleable. Like I was talking before with that flow, everything can work if everybody's on the same path and has the one goal. That's how I see it.
I think we we all need to realize as well that plans are funded based on what they believe, what the planners believe the needs of that person to be. We set up a list of goals are set up based on meeting that person's needs during that plan. Short-term goals, medium-term goals, long-term goals. A good planner, is only able to design a plan, an NDIS plan, that meets the needs that's been explained to them. Back in the day, when the NDIS was first being rolled out, as behaviour support practitioners, we used to be able to go to planning meetings with the support coordinators and the families. And it was a great place to be because you could see the real understanding of what that planner was seeing. But they didn't always understand. They could read what was on the paper, they could read what was in our reports, but often it was downplayed. And of course it would be. It's very confronting to go out there as a parent or a loved one and say, I can't cope. There are holes in every wall of my house. If I roll my sleeves up, you will see bruises and bite marks all over my body. That's incredibly confronting. And a planner doesn't always see that. Most people come into a planning office, an NDIS office, a Brotherhood of St. Lawrence, whatever it might be, depending on what state or territory you're in. And they will go there and they will present. And when they're presenting, they may be emotional about it, but they can't really paint a picture without that planner really seeing what's going on behind the scenes. So if funding isn't adequate to meet the needs, we should be working with the planner, the support coordinator, the families, the decision makers to really advocate for that person. We're only as successful as the time and the care that we're able to be presenting to that person, and everybody has an important role to play. Communication, again, is the most intrinsically important thing that we need to do. We need to communicate together. We need to have those care teams, and we need to see what's working and what's not working and where we can help with the people. You know, we might develop some communication tools, but we're not speech pathologists, you know? So if there is a speech pathologist there, let's lean on them. Or if there isn't, let's talk to the support coordinator and see how we can maybe get that into a person's plan. Let's advocate for that person and the families to get what they really need so that we can improve that quality of life with respect, with dignity, and with choice for the people that we're supporting.
Can I add to that, Ange? Sorry.
Sure.
Caitlin actually posed a question, and I'm sorry, Kayla, about how do we explain to the NDIA the need for psychology and PBS. First off, Caitlin, on our YouTube channel, we've got a webinar there from our specialist support coordinators that actually really discuss the intricacies and how the NDIA has changed the way that they look at funding now. It does not specifically speak to psychology and PB and BSP, but it will give you the insight and the strategies as a support coordinator to guide how we look at trying to increase funding in different areas. And one of the most important things is to show the NDIA that we've tried all these strategies first and they haven't worked, and that we need this extra assistance and why. So the NDIA fall on behaviour support first before they go down the psychology route. And it will depend on, every case will be different, and it will depend on that particular participant, their diagnoses, their support systems, what was tried and what was not, as to whether or not they will accept psychology and BSP on the same funding level. So I hope that within the short time frame that we've had actually helps answer your question as well.
I think just to add to that as well is you're incredibly correct. They are absolutely not the same supports. When the NDIS was first rolled out, the line item for behaviour support for any of those, and I know there's one or two people in this screen that will remember this, it used to say a PBS practitioner. Underneath the description of a PBS used to say a psychologist for blah, 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 blah. It didn't mention any other person that could do behaviour support under there. So it was particularly homing in on psychology. It is an incredibly different support. Yes, they're both in, if you like, social sciences, but one should not be compared to the other. So when we are writing, and a behaviour support practitioner can write a recommendation report to highlight those differences of what we can do versus what a psychologist can do in order to try and advocate for that separate funding where possible as well. And I have seen it in a few plans where we do get both, and it's really important for us to work alongside the psychologists, just like it is for those psychologists that aren't funded through the NDIS, but maybe through the hospital system where we're working with somebody who's been or recently about to be discharged from hospital. The psychologists there, you know, it's a very great relationship when we can work alongside the different levels of expertise and a lot of pracs do have psychology backgrounds, myself included, but it's not something that we use in our day-to-day practice. It's something we draw from, but not something that we use wholeheartedly. So it is a very separate entity, and it should be explored. But as we know, with the funding in the NDIS, that's a different story. Anyway, over to you, Emma.
Thank you. I'm very mindful of the time. Thank you, everyone, for joining us today. It was a great session, and I certainly learnt a lot. So thank you very much. We've got a next webinar coming up on the 20th of August. So we would love to see you with that. Thank you again for joining us, and have a wonderful afternoon. Bye.
Thanks, everyone.
Bye-bye.